Okay, what would you suggest for people who have terminal malignancies? What would their nutrition be then?
Again, the same thing. See, problem with the terminal malignancies is a lot of them have loss of appetite.
Oh yeah,
So,
that's the
so
thing.
even if you tell them to have a whole bunch of things, they'll not be able to have.
So what can they have, doctor?
It depends. I mean, whatever they feel like. We normally don't tell them to. We don't tell the relatives in order to force them to eat,
Right, right,
because
right.
that's not going to help. They'll probably throw up, or it's not going to make much of a difference. So whatever they feel comfortable with, you can have.
Okay,
So
it's
if they can't
always
have solid food, you can have liquids, more of juices. Again, like I said, protein powder mixed with milk. Probably
okay.
easier to digest. Even with water, you can have the protein powders.
Right, right, right,
So
right.
terminal cases, it's up to them. Honestly, it is whatever they are comfortable with, whatever they feel like eating. It's up to them. You don't force them with medicines also, and you don't force them with diet also.
Right, doctor. Right. You don't force them. The patient is at ease. The patient should be at
Yeah. So
ease.
there, the main thing again, like I mentioned earlier, is quality of life. So
Quality.
you can't really force them. Now you eat, now you eat. So it doesn't really help.
Yeah. Doctor, also one more thing. After surgery, like say, for example, the person, an organ has to be replaced, or I mean, not replaced, sorry, that's not the word. If how do you bring the body back to normalcy once an organ is removed, maybe, or
Yeah.
what is
So
the
that
aftercare of
is
that?
yeah. So that is like, see, like any other surgery, removal of the organ really doesn't make any difference. It is like whatever the body has gone through the surgery, the stress of the surgery, it takes a couple of weeks for the body to come back to normal.
Exactly that. Yeah.
Yeah, so that's about it. But that is the same with any surgery. Like even if you've not removed an organ, if you've done any other surgery,
Okay.
so whatever time, 2 weeks, 3 weeks it takes for the body to come back, that's
Okay.
about it. For example, like if you're saying if a kidney is removed or half the liver is removed, it doesn't really affect the body too much.
Yes.
The body compensates and it starts functioning the way it is supposed to.
Okay, you're saying that the body complement. I mean, it will have
It
an
gets
effect
used to
on.
it. It's yeah, it is like body can live with one kidney also, or half liver also. Or if you
Okay.
remove part of the intestine, again, it'll get used to it. Unless it's a very, very major surgery where you're
Like.
removing most of the intestine, and
Oh.
there is something called stoma, which is got out of the abdomen, and you pass stools through that into a bag.
Right. Right.
So that is more of a mental thing, getting used to it rather than a physical thing. So it takes a little time for the patient to get used to the fact that he's passing stools outside the body, into a bag. But
Okay.
from the physical point of view, it is not much.